if we're changing from a diagnosis-based waiver to a needs-based waiver, will that remove an individual from the waiver if there are individuals with greater need? Absolutely not. Once you have a slot, you have a slot. That said, we have to abide by the federal regulations where you're using, in order to maintain a slot, you have to use at least one waiver service in a quarter. Otherwise, that's the only way that you can lose your waiver slot. Another question is, since moving from South Dakota last year, we're not able to get on Iowa Medicaid, got on the wait list for health and disability and intellectual disability, and was told it's going to be 4 to 6 years. Daughter's 12 years old, and it will be too late for all of those therapies to be as effective as they can be. What can we do? So this is one area where there was also a disparity, but we have priority needs assessment forms that you can fill out if while you're on a wait, you have the risk of institutionalization or some poor medical outcome. You can fill out this priority needs assessment. Historically, this has only been available for the ID and the intellectual disability and the brain injury waivers, but we are making it accessible across the board because there are varying levels of need, and we want a pathway for those at risk, regardless of what the diagnosis is. It's really, really important. So if you don't know how to access the priority needs assessment, again, Google is our friend sometimes. But if you just Google Iowa Medicaid priority needs assessment, it should take you right to that form. How can families get training on CCO? The ISB says that that's the MCO. The MCO says it's the ISB, and no one answers questions, just denials. Wow, how annoying. Yeah, families definitely should contact their case manager for this. And we're going to cascade this information out to our MCOs as well. Christy Casey is one of our long-term services and support staff, and she has volunteered her email as well and said that she would be happy to assist also. She also said that you can reach out to your home and community-based specialist in the area, but I will, after we're done here, I'll send these questions and answers out as well, so everybody has information. Will Iowa ever get state-run PMIC availability? My daughter had to go to Utah, and as a parent, it breaks my heart. It would me too. We are working right now on a lot of effort to try to get our PMIC providers in the state to expand, but also to specialize in some areas that they're not specialized today. PMIC, good question, Cynthia. Sorry for the acronym. Psychiatric Medical Institution for Children. And so right now we don't have a whole lot of access for kids who have co-occurring intellectual disability and mental health challenges, which, you know, how often does it happen where a kid only has mental health challenges? They usually have other needs as well. We also have some challenges with finding places for kids that are aggressive or have problematic sexualized behaviors. And so we're trying to work with our PMIC providers with this most recent appropriation, to leverage those dollars to specialize in some of these areas where we are seeing kids go out of state. Also, just frankly, workforce challenges have not allowed for PMIC providers to fully staff all of the beds that they have available. And so this increase is also, we're hopeful, will allow PMIC providers to staff up so that they can open all of those beds and increase access in the state.